Sleepy Pants. How are you doing? Feeling a little bit better? Yeah, you fell asleep in the middle of the last exam. It's nothing to worry about. We were just worried about getting you as comfortable as you possibly could so that your body was allowed to heal. That's okay. Are you feeling a little bit better? Sore? Yeah. I had a chance to talk to some of the other nurses and my supervisor, and because you don't have any recollection of what it was that happened to you, we just wanted to be precautionary and take a couple of samples. You have some dirt in some of your ear, and you've had some cotton fibers that look like they might have been articles of clothing, but they weren't part of what you were wearing, as well as some dirt underneath your fingernails. And I don't mean to alarm you, you're completely safe here. Whatever happened to you, if it was just a fall, if it was something else, you know, you tripped and you can't recall what happened or where you were going, that's okay. We're not here to judge you. But the topic of self-defense, and in case there was another party that's involved, had come up, so I wanted to kind of just discuss some things for you, but I just want to emphasize how safe you are right here, right now. No one's going to harm you. You are as safe as you possibly can be. Okay. Alright, I know this is a sensitive topic and I don't mean for it to be traumatizing, but sometimes the topic of self-defense comes up after the fact, and it would be good just to have these little mental notes in your head in case you ever run into something like that. I'm not saying that was the case here, but it's always good just to have in the back of your brain. Okay. And before we get started with that conversation, though, I just want to do some general checkups on points of interest real quick. You had some bruising on the underside of your lip here. Do you mind if I take a quick look in your mouth and see how that's progressing to heal? Okay, thank you. And if I press down on your teeth like this, does that hurt? How about this tooth? And this one? Just looking at your other teeth here. Can you clench your jaw shut? Go like that. Okay. Your top teeth look good though. Still no recollection of what happened? Okay. That's okay. I'm going to take a look into your eyes. I'm going to pull your eyelid back a little bit so I can take a look at the blood vessels towards the back. Go ahead and look away. Yeah, with a fall, go ahead and look away. With a fall or any kind of trauma, we would kind of expect to see some blood vessels that are a little bit redder than most. That's normal. It doesn't necessarily indicate anything, no. Alright. Your reflexes and your dilation are definitely better than they were last time. So what I'd like to do, with your permission, is I'd like to take some tape and just pat it on various areas of the skin to pick up any of the debris that we didn't wash off from the previous exam. Is that okay? Okay. And the point of this is just to pick up any kind of cloth fibers, any kind of dirt, debris, and then we can send them to a lab for further analysis. Are you comfortable? Okay. Yeah, I want you to be as comfortable as possible. Okay. Just picking up any foreign fibers, some dirt. It's a nice day outside. You can hear the birds all nice and cheerful and happy. I like the birds. The birds, however, wake up way earlier than I do. They always wake me up in the morning. I guess there's worse things that you can wake up to. I'd say we got a good amount of tissue samples there, so we'll be able to take a better look at that and see just what kind of material was able to settle on your skin, whether or not it's something we need to worry about, a bacterial or a fungal infection, if it's just vegetation matter or anything like that. Okay. I'm going to take a separate piece of tape and do the same for each individual ear. Your ears have a little bit more of a closed area where moisture and debris can easily settle in. So to avoid infection, these are one of the areas we want to get samples from the most. Kind of in the upper curl of the ear. Okay, and that is the right ear. Okay. I'm going to get your left ear. Alright, and there's for the other ear. When I was talking to my supervisor about what may have transpired and led you to be in our company here, the fear was that someone else may have been involved, and that some of the cotton fibers that we had pulled from your hair may have been possibly clothing that another person would have worn. I don't want to scare you. You know, that's a sensitive topic to talk about. But one of the other things that we'd like to discuss is some ways for self-defense if you ever find yourself in that situation. You're safe here. No one is going to harm you. These conversations are 100% judgmental free. or judgment-free. So if you have questions, if you have thoughts, just keep in mind that you're in the safest environment you probably can be, okay? Alright. One of the things that you may encounter, well, the best method of self-defense is avoiding any kind of interaction with someone that might be hostile. Obviously, that's not always a choice. One of the sensitive regions that you can go after, though, if someone is pursuing you and they're unwelcome, if they put their hands on you, if they try to grab you by the arm, grab you by the neck, there's a couple of places that you can always go for that will be the most effective, and vision is definitely one of them. Anything that has to do with eye gouging, particularly in this region right here. You have very sensitive spots on the sides of your nose, and any time that you can affect the person's eyesight, those are two places that you will very quickly disable the person from continuing. So depending on how you may be positioned, if you are within arm's reach, the first thing that you can go for is the eyes. If you can reach the eyes, if you can reach the nose or the face, eye gouging, whether or not you do it with your hands like this, and then just go straight towards the person, right in the face. If you can't do that, if you're short like me, and someone were to approach you and it's unwelcomed, and you tell them to back off, you can always, with the blunt force of your palm, jam up, extend your arm as straight as you can, right in the nose. The jaw, the nose, the face, and the center here is a very effective region that you can hit. Anytime that unwanted contact occurs with another person, and if they do not heed your warning to stop, make as much noise as you possibly can. When you attract attention to the situation, other people will probably get involved. I know that's not always an ideal circumstance if you're alone in a park, or if you're alone in your home. Making noise may not necessarily be a good option, but it's usually alarming, and it usually causes distress from the attacker, and they're very likely to just leave. Other things that you can do is disable vision. Vision is a key component for the attacker, and if you take that away from them, they will usually be more concerned with themselves than continuing an attack. While we're doing this, I'm just feeling for any kind of abrasions, any kind of new swelling areas that might be in the process of bruising, so just try your best to relax as much as you can. I know this isn't exactly a comfortable conversation, but disabling your attacker's vision usually immediately ends the conflict. Scratching, gouging, hitting, you have a lot of force with the blunt side of your palm, and that can be very, very effective. Gouging and scratching will also do very similar. If you have the room to swing your arm, also using the sharp end of your wrist, even if it has to go down your forearm, the neck also causes immediate distress to your attacker. So if someone has you, say, by the wrist or by the upper arm, and you have the opportunity to swing and hit right on the side of the neck, that will cause the windpipe to usually collapse, and then they have no oxygen, they have to breathe, and that takes them a moment to focus on themselves rather than you. So the primary areas with self-defense are the tender ones. Eyes first. You can't do anything if you can't see anything. Nose. Nose causes immediate trauma. Hit upward if you can. You can also do that with the jaw, and that will knock the head backwards. Ears. If you are able to get a hold of the ear and pull very, very hard, that can also cause immediate distress. but eyes, nose, throat, ears. There's other things that you can do if you are standing and if you have the physical capacity to do so. If someone grabs you by the wrist, the groin and the knees are very sensitive areas, especially if the attacker is male. And this isn't just to say that attackers are male, but if you were to kick inward on someone's kneecap, that causes the attacker to collapse. Also, kicking in the groin, even if it's a female, the groin is a very sensitive area and immediately causes the attacker physical distress. Once you're able to break free, yelling as loud as you can, attracting as much attention as possible, that will get you to a safe place, hopefully. Your face looks like it's doing much better. There's no major areas of swelling. I'm just going to comb through your hair a little bit here with my tweezers and part through and see if there's any other debris that we might have missed, okay? Hair pulling is another method, but if you can grab the nose, the eyes, the throat, ears, groin, and knees are the most sensitive and most debilitating areas that you can hit for immediate distress. I'm just going to go through your hair a little bit here. There's still some dirt, and I don't see any major lacerations that we haven't already addressed. You're going to heal up nicely. Just going to grab a little bit more vegetation. Do you remember what you were doing previously in the day? Were you going for a walk? Were you going shopping? Did anyone else know where you were going? A little bit of dirt here. I think that once we get you on the final stages of healing, we're going to come in and we're going to give you a nice sponge bath. Get the remainder of dirt out of your hair, things that we can't do one stick at a time here with tweezers. But you're safe here. Okay. Alright, we're going to move on to something a little bit more tedious. I'm going to take your hands and I'm going to run a sharp pick. It's not too sharp. I'm going to run that underneath your fingernails and get as much debris out as we can, okay? If you have fingernails, if anyone ever approaches you and puts their hands on you, even if you don't have very long fingernails, one very good way of documenting the incident is to scratch. Your fingernails often accumulate a lot of debris, a lot of dirt. And if you scratch, let's say for instance that the perpetrator like it's within arm's reach of you. If you can gouge skin cells, blood cells, hair cells, anything off of that perpetrator. Not to scare you, I know it's a sensitive topic. Scratching is a good deterrent. And it's also a good way to accumulate something that can be investigated. Just a couple more fingernails here. Just getting the debris out from underneath them. This looks like dirt. This doesn't look like anything harmful or another person or anything. There we go. So we have our samples. And we're going to send those to the lab so that we can further test what's going on, okay? Alright. The next part is we want to check for any kind of head trauma. So what I'm going to do is I'm going to take the blunt, pointy end of a chopstick. It's not going to hurt. I'm not going to press very hard. I'd like you to close your eyes, and I'm going to press on various parts of your body, well, of your face and your ears. I'd like you to tell me when you can identify that touch, okay? So go ahead and close your eyes. Mm-hmm. 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 I'm going to take my tweezers and I'm going to very lightly pinch your skin. I'm going to lift a little bit. I want you to tell me if that feels normal to you, okay? Okay. Mm-hmm. Mm-hmm. Your ears. How about right here? Okay. I'm going to wiggle my fingers. I want you to just stare right at the bridge of my nose. And I want you to tell me which side it is that I'm wiggling without directly looking at them, okay? Good. Okay. I'm going to press on one side of your face at a time here, and I want you to tell me what side it is that I'm touching, okay? My hands are out of view, correct? Okay. Correct. Correct. Different part of your face here. Mm-hmm. Go ahead and close your eyes for me, and I'm going to do this right here. Okay. Correct. Mm-hmm. Mm-hmm. Correct. Now up above your eyebrows. Correct. Correct. Mm-hmm. Now I'm going to pinch. Tell me if any of these areas are tender, okay? A little bit? Okay. Do you think that might be due to a headache or... Yeah. Okay. I'm going to take an item that is made of porcelain. It's going to be cool to the touch. Okay. And tell me if it feels cold to you, okay? Mm-hmm. Mm-hmm. And you feel the temperature difference, correct? Good. Gotcha. Well, I don't think that there's any complications with your sensory, which is good. We'd normally be worried about a little bit of head trauma, and I don't see any indications of that. Just the lacerations. Okay. Alright, the last bit before we let you go for the day is I'm going to check inside of your ears to see if there's any debris, any swelling, any blood, anything like that, okay? It's nothing to worry about. You're completely safe and in capable hands, so if anything needs to be taken care of, we'll do so, okay? Just relax. Just lift your ear a little bit here so that I can we found most of the debris out already. Okay. Just gonna reach over here. It is a little bit swollen on here, but I don't see any kind of trauma, no blood. Everything looks like it's nice and clean, but it is a little bit irritated. Alright, I lied. There is still two more things I'm going to do, okay? First thing is I'm going to press on this area because I'm worried about possibly a fractured jaw or anything like that, especially your teeth. So I'm going to press all along your jaw. I'm also going to check your glands while I'm just feeling around here. I'm primarily checking for bruising, so if any of this causes you pain, distress, let me know, okay? Do you mind if I pull your bottom lip down a little bit? Yeah, I'm trying to be gentle. I know it's tender. Feeling your glands. But on the top lip here, does this hurt at all? Just a little bit. Okay. I think that we might schedule in for a x-ray to make sure that the roots on your bottom teeth are particularly intact and that there's no other side effects other than bruising. Okay. One last thing for me. Do you mind going like this? I know that's going to stretch out your gums. Okay. How about just one side at a time? Now the other? Okay. Does any of that hurt? What about like up here near your jaw and your cheekbones? Do you mind rotating your head around a little bit and telling me how the rotation feels? A little bit stiff. Okay. Well, I have some plans for you. I think what I'd like to do in the next couple of days is to first get an x-ray of these teeth, and then we'll focus on whatever is necessary to get that part all healed up and feeling great again. And then we'll also get you nice and cleaned up, an official shower, or an official bath, as well as possibly looking into what's going on with the neck in the next exam. I think right now we're just primarily concerned with getting our results back and finding out a little bit more details of what happened to you afterwards. We can hopefully move on to the next couple bits of recovery. Okay. Alright, dear. You're safe here. If you choose to fall asleep, that's perfectly welcome. Yeah. Alright. Just ring the bell if you need anything.